Cataract surgeries become safer, modern, less healing time, more predictable healing, sometimes days apart. Traditionally, we would do one eye at a time. We would usually wait several weeks to do the second eye. More recently, as cataract surgeries become safer, become more modern, less healing time, more predictable, we are moving it closer and closer. I'll even do them sometimes days apart, sometimes even on the same day. Deciding when to do the second eye, it's the patient's schedule, it's their comfort level. Some people really want to say, well, let me just see how the first one goes for a little while and then we'll do the second one, especially those people who are really nervous going in. Some patients say, if you can do them in the same day, that'd be great because I want to be done with it and my schedule doesn't permit. We'll accommodate those folks as well. It's less common to do them on the same day, mostly for, at this point, insurance reasons. A lot of your insurances, they want you to document that. They want to make sure that people don't say, oh, I'm good now, I don't need this. Sometimes the insurances will sort of force us to break it up, at least by several days, but sometimes we'll do them both on the same day as well. Having a cataract is not a reason just to take it out. If it's not causing symptoms, if it ain't broke, don't fix it, as they say. Sometimes a patient will come and they'll say, I was referred here for the cataract, but I'm not really noticing anything. We say, you do have a cataract. Sometimes I'm even a little surprised that they're not noticing it because it can be a pretty significant looking cataract from me looking in, but it's all about really the time we went into surgery is their experience looking out through it. Not having any symptoms, we'll just follow it a little while. Other times patients come in and they want it resolved quickly. We can usually do that usually within a couple of weeks from the date of the first visit. A lot of people who have cataracts, they go in to get new glasses and they just feel like the person prescribing their glasses is doing a bad job. They say, I've gone in to get glasses, they weren't any really good, the prescription didn't work or it only worked for a short time, and then they think that they need to go back in and get the prescription right. They don't realize is no matter what prescription you put in front of your eyes, if you have cataracts, you're not going to see well. Around the world, cataract is a leading cause of blindness worldwide. If they can prevent them from happening, particularly in places like very rural, sub-Saharan Africa, very poor countries, then they can prevent a lot of blindness if they can prevent cataracts rather than finding ways to take out cataracts. There's been a lot of research. Nothing has really been effective. I mean, they thought at one point some beta blocker types of drugs might be effective. Over the years, have thought maybe certain types of antioxidants or avoiding ultraviolet. None of those things have really helped with cataract. Cataract just seems to be a ubiquitous thing with aging. We're still working on it. It would be great if we could prevent them in the first place, but so far we don't have a way to do it. The term premium lens comes from the industry who makes lenses. They basically are lenses that help you see better without glasses, and they call those premium. And the reason why they're premium is because a lot of times they're a little bit more expensive for the job that they do. These lenses generally help you see better without glasses. Premium lenses include something like a toric lens. If you have a lot of astigmatism and you want to have that astigmatism fixed, you can get it fixed in a pair of glasses. You can get glasses for that. But at the time of cataract surgery, we can also put a lens in your eye that can fix that astigmatism using the lens inside your eye instead of you having to wear glasses on the outside. To build that astigmatism correction into the lens costs more money. They call it premium. It's considered a premium lens, and that usually entails a little bit of out-of-pocket cost to the patient because the insurance companies generally don't want to cover the upgraded optics in those lenses, so they just pass that expense on to the patient. Cataracts, macular degeneration, other things, glaucoma, even dry eyes. All of these things are contributing to your decrease in vision. They're all cumulatively causing the vision that you have. In terms of fixing it, when we do your cataract surgery, I try and tell them, okay, your cataract is going to be gone. You're going to get everything back that the cataract is causing. I try to give them an idea based on the health of their eye in terms of the other aspects of what's going on, what they can expect. At the end of the day, there's nothing that you can say that's 100%, but I try and say, I think, judging from what I'm seeing, probably your macular degeneration is causing this sort of distortion, but all the blur is from the cataract. When we're done, you're still going to have some distortion of your vision, but it's going to be a lot brighter, a lot clearer in the other areas. And as long as you deliver on what they expect, people understand. Cataract surgery does not fix every aspect of eye disease, but it definitely improves it. And I always like to tell people you're going to get the best vision you possibly can. In terms of dry eye, I always like to treat dry eye before cataract surgery. Cataract surgery will temporarily cause a little worsening of the dry eye, sometimes weeks or a couple months. A lot of times it then goes back to the baseline, so I always give people that heads up. You know, your eyes are going to be a little drier after your cataract surgery. Just expect that, and then it's going to rebound back to where it was, like it is now.